My name is Kim Smith, and I'm with the Marshall-Harrison County Health Department, and we're going to record this orientation. That way, if any other students that didn't make it, they can see the orientation and get credit for the 1 hour course, or the 1 hour lecture here. So go ahead and open up your packets, and you've got an orientation outline sheet that looks like this. What we're going to do is go just a little bit outside of the outline. We're going to rearrange some things. And of course the welcome is first, and I told you what my name is. And I'll tell you a little bit about public health and our specific public health department. Let's jump down to item number 3. We're going to do that one next. So what is public health? And public health is basically health care. We don't really take care of patients, but we deal with the health of the public in general. And for example, you probably don't see a whole lot in your lifetime having to do with public health, but public health monitors, and we call it surveillance, and we do surveillance on immunization rates in our community. Or if, for example, we have an outbreak of measles, that would be another way of surveilling, or surveillance rather, and the public health department will monitor that. Public health also has different programs in different communities, and it depends on the community as to what is important for that public health department to be part of. For example, in our public health department here in Marshall and Harrison County, we have 4 programs. We have TB elimination, which is tuberculosis. We try to get rid of anybody that has tuberculosis. We'll treat them and test them. We have an immunization program, which means that anybody that cannot afford immunizations, they can come to the health department and get immunizations. And that way there's no reason, or there's no barrier, we call it, that people cannot be properly immunized against some vaccine-preventable diseases. Another program we have is women's health, and that means that we offer annual exams for women to get health screenings, pap smears, and so forth. And we partner with gynecologists in town here, and that women, if they don't have any medical insurance, they can get their annual exams. And then we also have an STD clinic. That means that anyone who wants to get tested for an STD, and we test for 4 different kinds. We test for HIV and syphilis and gonorrhea and chlamydia. And if anyone can come in regardless of eligibility, and they can come in and get a blood test and give a urine sample and get tested for any of those. And if they test positive, they can also get treated for the same fee, which is $15. So those are the things that we do in our public health department in Marshall. So let's look at kind of a broader idea of what public health is. Like for example, in the state of Texas, we also look at immunization rates. We also look at what health things are affecting Texans. And right now, Texans are obese. Texans have a high incidence of diabetes and hypertension. So we're looking at ways to decrease that. And just on a side note, in Harrison County, we're looking at twofold. How can we get Harrison County residents to increase their exercise, and how can we get them to eat better? So we're looking at ways to do that also. So that's something that public health will do. Right now, I'm talking to you just from a local health department, but there's also a regional area, which means that there's an office from the Department of State Health Services in Tyler that governs kind of what we do, and then on the state level, they govern what the regional levels do. Hello, go ahead and sign in and grab a packet, please. There's some other careers in health and public health, and one of them is epidemiology. You can be a nurse and work in public health, and you can also, and we'll talk about careers later, work as far as global health, and that would mean going to a foreign country, taking an assessment of what things are important health-related problems in that area, and then trying to fix those problems. So that is item number 3. Let's jump down to item number 4, and we're just going to bounce around on your outline here. Item number 4 is patient flow and medical records. So if we go back to the local health department, which is next to the hospital, and you guys will be making spending, I think, 8 hours at the local health department, you'll see that we have a patient flow. Someone will come to the window and say, okay, this is what I think that I have a problem with, I need some help with. And so the receptionist will take down their information and then tend to them and collect their money if they need to, and then take care of the problem. And it was one of those 4 programs that I mentioned to you. And so the medical assistant will call the individual back and take care of whatever they need. We have 3 exam rooms, and then we also have a lab, and I'll give you guys a tour of the health department when you do your orientation there. And then once the patient or client is seen and treated, then they might get a follow-up appointment, and then they will also check out from there. So it's set up basically like a doctor's office. Any kind of clinic is set up like that. So that's pretty much the patient flow. We have a medical record, and we are paper-based in our clinic. That means that a patient has a record. It's just a regular folder, and it has their name on the side. And it has all the content that kind of tells a story. So every medical record basically tells a story about that patient. For example, if he came in and he said, I need to be tested for an STD, then we would take his information down, set up a chart, ask him to come back, draw his blood, get a urine specimen, and tell him we want you to call back in a couple of weeks for your results. And if he's positive, then we would ask him to come back and he would get treated. So that's kind of the patient flow, and then everything that we do is documented in their record. And that means that tells a story of their visit. Now on records or medical records, it's very important that we keep that information confidential. And so I want you to look at a couple of things in your packet. One of them is, you don't have this information, do you? The HIPAA, I think I just printed it off for myself. But you do have the confidentiality policy and agreement sheet. That looks like this. So when you hear someone talking about HIPAA, that's an acronym that means Health Insurance Portability and Accountability Act. And that was something that Congress in our federal government put in action in 1996. And that means that clinics, hospitals, doctor's offices, whatever, has got to keep your information confidential. And especially now that we have cell phones, it's very easy to take a picture of somebody or take a picture of a document and spread it all over Facebook or whatever social media. So it's really important. Anyone that works with medical records keeps that patient's information confidential. We live in a small town, and when you have a small town, it's easier to know people and to recognize names on medical records. So when you come into the clinic, it's very important, even if you know somebody, even if you see their record, if you don't have any business being in that record, it's very important that you do not access that, and snooping is not allowed. If you are asked to go in to an exam room with a nurse, and then you do have access to that patient's information in that record. But once that patient leaves, it's not your business to be going in and opening charts and kind of sifting through, unless you're asked to do something like that. So that's very important that you all understand that confidentiality is very important. And so to make sure that you understand that, when you come to the clinic, we'll go over this information again, and then I'll have you read and sign the confidentiality policy and agreement, and you can just keep this for yourself right now, and then I'll have you sign it when you come to the clinic. But I just want to make sure that you all understand not only what HIPAA is and confidentiality, but that you will sign that you will not be doing anything. Because you're responsible for yourself. I'm responsible for knowing that you have that information. Okay, back to our outline. We covered the welcome, we covered HIPAA and privacy, we covered somewhat of what is public health, we covered patient flow and medical records. Let's talk just a bit about professionalism and etiquette. And professionalism kind of is a whole bunch of different things, but it just means that not only your appearance, but your behavior is going to come across professionally. And I'm sure you've already had lectures and teachers talk about professionalism. But let's talk about appearance first of all. And when you work in a health department or any clinic, and it's important that you come across professionally, which means that you're not going to dress or put your makeup or jewelry the same way you would if you were going out to either a state fair or to a bar or something like that. We're going to dress kind of conservatively. You can wear jewelry, but make sure you don't have real long dangly earrings to get in the way of talking on the phone or to meeting patients. If you have tattoos on your arms, you'll wear something to cover the tattoos. And you're going to dress to where if you have a blouse, when you bend over and draw blood or do something, somebody can't see all the way, you know, down to your belly button or your toes or whatever. So just make sure that you dress professionally. And we'll go over this again. You don't have to buy scrubs or anything like that, but just regular casual clothes. Make sure that your clothes don't have rips or tears in them. Make sure you have regular shoes instead of flip-flops. That way it protects your feet in case something falls or in case a box drops on your feet, or if we have a kid that is running down the hall that they don't want to get a shot, then your feet are protected. So that's just a bit about appearance and professionalism. Wearing your hair back is great, but I'm not requiring that. But just something that is conducive to the job that you're doing. Because you want to portray to our customers, which is our patients, you want to portray that you know what you're doing and you're a professional person. Even if they are not, you want to come across that way. Even if you don't know anything about public health or nursing or clerical duties, you want to at least look the part, whether or not you have it yet in here. And if you don't have it in here, that's okay. That's what you're doing this orientation and internship for. Etiquette is another thing on professionalism, and you want to make sure that you come across to other people as that you have good etiquette. Like if you're asked to answer the phone, you want to identify the organization that you're with and identify yourself. And that way the person who's calling knows who you are, and if, for example, someone at the hospital, the infection control nurse is calling, they know that a student will not be able to answer their question, and so they'll ask for whoever else. So it's important that you identify yourself too. Other etiquette is just making sure that file drawers are kept closed. That way someone coming behind you won't not see it and trip over it, or just any kind of good behavior, things that you would learn to be nice people that you might learn in kindergarten. So that's proper etiquette. We talked a little bit about presentation and make sure your appearance is neat, that you come to the clinic, make sure you've taken a shower the night before or that day, not working out in the yard, you know. Attitude is really important, because when you're a professional person, having a poor attitude or wanting to sit in the corner and play on your cell phone while you're instead of spending time learning, that's all part of it. Or if someone asks you to do something, well, I am not supposed to be doing that. You know, that's not the right attitude. If you feel like someone's asking you to do something that you shouldn't be doing, there's a good way and a bad way of responding. So attitude is important. Promptness is also important. If you're asked to come from 10 to 12 and spend your 2 hours in the clinic today, I expect for you to be there from 10 to 12 and not out in the parking lot talking to your mother for 30 minutes, or make sure that you show up right at 10 o'clock when you say that you were going to. So promptness is important too. That way we're all on the same page. I know what to expect, and you guys know what I would expect that you expected me to be there at the time, unless there's emergency, of course. But and then communication with leadership. It's important for you to let me know, hey, we had a family emergency, I can't come tomorrow, but I would like to make up this time, you know, and then have an alternate day. So communication is important, not just to leadership in the department, but also to the other staff there. So that way we all work together. Having students come to the clinic is important to me. I'm real big on education, and I love having students. But it's a value to the clinic also, because students have this energizing appearance with them. You know, they're eager to learn, and so that's the value that you guys bring. When we have visitors in the clinic, which you guys are visitors, then the staff is also, at least for a little bit at a time, they're on their best behavior because they want to make a good impression too. So you guys are a value to the clinic, to us, so we're really happy to have you too. That's all I have on the outline. I want to tell you a couple more things. One of them, let's talk a little bit about the program. You've got a sheet in your packet, and it starts with spring of 2017, and the next paragraph is a description. It kind of looks like this, and it'll have a number of hours that you'll spend with this internship. Let's look at that briefly. The internship orientation lasts 1 hour, and that's today. And then we'll have another 1 hour course, I call it a course, or lecture on project management concepts, because a lot of your internship is going to be working on a project. And so we're going to talk about project management concepts, and you probably have a sheet that has project management concepts, and it has some bullet point items. And we'll go over that next week when we talk about project management. So we'll do that next week, and that'll be another hour for you. And then you'll have a clinical rotation for 8 hours in the clinic, and that'll be, like I said, 8 hours, and that'll be on the schedule that you and I agree on. And then we have 2 projects, a jump rope performance and clinic, and then also a tobacco cessation program. And those are 2 things that we talked about just briefly, about some of the things that the health department works on. And these are some things that I've identified in our community that we can try to get people more active. And I would like to start with the little kids, the elementary school kids. So I thought, wouldn't it be neat if we had a jump rope performance and a clinic? And the performance would be to where either high school or college age students would do a really neat 15 or 20 minute routine, maybe with the double jump ropes, and show these little kids how much fun jump roping can be. And on the side, it is good exercise too. And then at the end of this clinic, then we would give away jump ropes. And then after the performance, we could show the students how to do some simple tricks and to kind of get them energized. It's different when you guys show little kids how to do something compared to when someone like me, who's older, shows them. They relate to you better because you're closer in age to them than they would relate to me. So they would be more open to what you guys are showing them. And I have in mind to go to the Washington Early Childhood Center, which is ages 3 to 5, and then also maybe elementary school. And this is more of a long-term project, and we'll talk more details about that project. So that's the jump rope performance and clinic. The tobacco cessation program is something pretty totally different that's geared towards adults, which is either tobacco cessation or tobacco use prevention. So we'll talk more details about that. What we want to do is prevent kids from starting to smoke, and also any adults that are smoking. We want to provide a way that they can stop smoking or using tobacco or vaping, whatever. So all of those hours will add up to the 60 hours of internship that you all will be receiving credit for. And then we'll keep track of your time and then just make sure that you get the hours that you need. Now, what I don't want to do is to drag this out for months and months and months. Also, that means that you will be prompt in showing up for the amount of time that you need. Now, if you think that this is not for you, then go ahead and just let me know, and that way Dr. Gorski knows too that you won't be doing the orientation, the program. One last thing that I wanted to mention is that I want to give you some, what I call success stories of what we do in public health. Now, most of what we do in public health, you don't see us on a daily basis, mainly because we're doing our job. There's not a big outbreak of diphtheria in our community. You don't see tuberculosis because we are keeping the cover on it. We're immunizing properly, we're identifying people at higher risk, and we're taking care of business, basically. But, so that, you don't see and hear much about public health. But a couple of success stories I want to tell you about. Just recently, we had a girl come in, and she's 6 months pregnant, and she wants to be tested for STDs. And so you think, oh, that's not a good combination to be pregnant and having that kind of infection, which it's not, but we went ahead and tested her, and she came back positive for chlamydia. And come to find out, she's 6 months pregnant. She knows she knew 3 months ago that she had chlamydia. She was treated at her doctor's office, but she wanted to come back 3 months later, which is what we recommend, and make sure the infection is gone. Now, just a little bit of background. Chlamydia is one of those infections that you can get rid of with antibiotics. So it's not a big deal, and it's not like HIV or syphilis that always stays with you, and it harms your baby and so forth. So chlamydia is, you don't want to have it, of course, but you can get rid of it. And also, she had relocated from out of state. So she got treated in another state, and then relocated here to East Texas. And so she was getting a new doctor. She had a lot of changes in her life. She was pregnant, she wasn't married, she was moving to a new location, probably getting a new job, so a lot of changes in her life. Well, she came into the clinic, and she said, I know that I'm positive, because we called her back and said, you're positive for chlamydia, please get treated. So she came back to get treatment. Well, I wasn't comfortable. The medical assistant called me, and she said, how do I do this, because this patient's pregnant? And I said, let me talk to her. And I told her, I said, we need a note from your doctor. Well, I haven't seen my doctor yet, I just moved here. And I said, well, when are you going to see your doctor? Well, I'm going to go tomorrow. And I said, that's fine. When you go to your doctor's appointment, bring a note back. She started tearing up, and she said, please, I've got to be treated today. I don't want to wait another day. I said, I understand, you're right, but chlamydia is not going to harm your baby. One more day won't hurt, but I want to make sure that your doctor knows that you're being treated for this, and he or she is okay with that. So she said, well, my appointment's at 1:15. What time do you guys close? And I said, well, we close at 5 o'clock. She said, what if it takes, my appointment in Longview takes longer and I can't get back? I said, take my cell number, and if for some reason you are running late, I will stay open for you. So what I guess I'm saying with this story is that in public health, we do whatever we can to make sure that people are taken care of. Just one other, well, it ended up fine. You know, she came back for her treatment, and she did get back by 4:30 or 5 or whatever, so she was treated, and then she's going to be tested again probably when she delivers, and hopefully she won't have the infection then. But another success story is that the other day I was at a friend's house, and I saw this little girl next door riding her bicycle, and as a mother, you're a worrier anyway, but I thought, I don't want to see her riding in the street. She doesn't have a helmet on. And she was about 10 years old and just having fun going around, and it wasn't a busy street, but there were a lot of people that were driving by. So the next day I went to work, and I called my friend that is the trauma coordinator at the hospital. I said, Jerry, do you have any more of those helmets that you give away every year? He said, oh yeah, sure, I'll bring one by. So he did, and I took it to her house the next day, and she wasn't there, but her dad answered. He said, thank you so much for that, and I'll make sure that she wears it. And so in public health, you have a different view, and you look for opportunities to help people and to make sure people are safe and they stay in good health. And so those are just a couple of examples of what we can do in public health and as public health officials. You know, what we did not talk about careers in public health, and I think you've got a printout. Or do you? Do you have a printout in your? Yes, that's it. Would you do me a favor, please, and get 2 packets, give one to him, and I need one, because I didn't get one of those sheets. Oh, thank you. So this sheet, like he showed us, is just a spreadsheet of careers in public health. And you can see there on the left side what type of careers you can do in public health. There are so many that probably too many to list, too many separate roles and positions to list, but there's just a handful here. And then, for example, you can work in the local public health department is what we do here in Marshall. And then just going across horizontally, the degree requirements are anything from a certificate to a doctorate. For example, we have medical assistants that work in our department, as well as we have a doctor that comes in 3 times a month to see women to do their pap smears. On the sector portion, you can work in the public. You can work at the state or the county or the city level. And so right now in Marshall, this is like the county level, but we also get funding from the state and city and the county. So that's kind of why I put that there. The entry level salary is anywhere from $21,000 for a medical assistant, over $100,000 for a physician. So it kind of depends on your role as to how much you make. And then the aptitude, that is an example of what are your internal strengths. And for example, if I didn't like people, if I just wanted to be in my corner and just do analysis, I would not be very well suited for public outreach. And because you have to talk to a lot of people, you have to talk to a lot of strangers, and right now there's 14 eyes looking at me, and so you might not want to, be in public health doing outreach if you don't like public speaking, for example. So it's good to understand your own strengths and your own aptitudes, so that way you're not mismatched with whatever job that you're looking towards in the future. Because if you've ever seen someone that's mismatched, they're miserable, everyone around them is miserable, and you think, why are you even in this career if you are miserable and you don't like what you're doing? On the other hand, if you see someone that is very well matched of what they're doing, it is awesome to watch them. We did a story time about immunizations at the Washington Early Childhood Center, and we told stories and sang songs with the little kids. After that, their principal got up, and she was up front just doing songs and just booming voice. She loved her job, and I said, Miss Fisher, how long have you been doing this? Oh, I have been in this career for 40 years, and I thought, and you still have not gotten tired of it. She used to be a counselor for little kids and went into teaching and then went to principalship. It was obvious she loved her job, and it was just entertaining for me to see because she just was in her element. To her, she wasn't going to work every day. She was doing something fun and getting paid for it. So it's real important that you understand your own aptitude and kind of align yourself with a job that you're going to have to do, for the rest of your life, basically. So I've listed some things of what kind of aptitude someone in that position would be good at. The next one is an epidemiologist, and what they do is they look at different diseases and different things that cause disease and say, hey, what are we going to do? Or are we seeing trends over the last several months? We see a spike in the month of January for influenza in this part of Texas. So they deal a lot with analytics and math and sciences. Their entry-level salary is around $77,000. And then, so probably someone that likes analytics and sciences might not be so good at public outreach. The next one is a little similar, biostatistics and informatics. They also look at trends and levels of diseases, whether it's on the state level or on the worldwide level, working for the World Health Organization. They also like math and analytics. And then I just put one other thing, public health policy. You might need a master's degree for that as well. And then average salary is about $60,000. And those people like to work in Austin at the Capitol and saying to our congressmen and our senators, we need a law stating that anyone who gets in a car needs to wear a seatbelt, because we have these figures saying that this many fatalities happened with people that didn't wear seatbelts and so forth. That would be an example of someone that would be in public health policy. I included some resources there, and you might want to visit the website of the Bureau of Labor Statistics. It gives you so much information on public health careers and what they make and what they can expect to do with that job. I listed some colleges there that have a master's in public health programs, and I know that you guys aren't ready for that yet, but you're taking steps towards that once you finish your bachelor's degree. And then also nursing schools, medical schools, and medical assistant are some other positions. So I think that pretty much concludes the orientation. And like I mentioned before, we're recording this, and so that way we can upload it to YouTube in case there's anybody else that missed out, and that way they can see the orientation too. Do you guys have any questions, maybe specific to the program or the internship? Well, I'm sure you'll have a lot of questions, more detailed questions as we get on with the program, but does anybody have any questions? No? Okay, good.
I'm curious about the jump rope clinic. Can you tell me more about that?
I can. The purpose of it is to get kids moving and get in the habit of exercising. And of course, when you deal with little kids, you want to have fun, because that's how you're going to rope them into doing anything, is how can we make washing dishes fun, you know? So the jump rope clinic, let me start with the performance. What I envisioned of that is to have you guys that are working on the project look up some performances, maybe on YouTube, or anybody else that might be doing just some awesome tricks with jump rope. And then talking to either college students, whether it's here at Wiley or at ETBU or TSTC, or even high school students, to say we need 4 volunteers to practice jump roping and do some of these tricks that we see on this video. And that would mean that they would have to practice and be not dedicated, but vested in that particular program or project. And once they practice, then we'll set up a time to where all the students at for example, the Washington Early Childhood will get in the gym, and they're gonna watch this 15 or 20-minute performance, the jump rope performance of what these girls or guys or both are gonna be doing. And the kids are going to say, I never knew you could have that much fun with jump roping, or you could do all those tricks. And then once that performance is over, then we would invite the kids to come and say, here, let me show you what things that you can do and you can learn now. And here are a few little tricks. And by the way, here is a free jump rope for you guys to do. Do you know, you're gonna see the kids practicing and practicing and practicing during recess, doing all those kind of things, because they look up to you guys as almost adults, you know, in their eyes, and they want to do what you guys were doing and showing them, basically. So that's the jump rope clinic, and the main objective is to just get them active, get them moving, because when you start a habit early, then it's easier to do it when you're an adult. So that's the details behind that. Yep. Any other questions? All right, very good. Well, once again, I really welcome you guys to this internship, and it's very valuable to us to have students. So I'm really glad that you all have decided to do this.
Okay.
All right.
Thank you.